Hello, everybody. I'm going to take a couple of seconds while everyone is joining the meeting. My name is Laura Nelson. I am the Regional Director of Marketing with Rothkoff Law Group. Thank you for joining us today. Before we get started, I'm going to do some basic housekeeping for the audience. We do have a very large audience today, so I am going to ask that you remain on mute. You will be able to unmute once Jerry and Bryan open up the floor for questions. However, please wait for that invitation as we do have a very large group joining us today for this discussion. In addition to that, if there is anybody who is joining us today that does not have access to a microphone or doesn't have a quiet background, you can absolutely enter your questions in the chat box and I will read that out on your behalf. This is going to be a recorded session, so I did pin Jerry and Bryan to remain on the recording end. You can feel free to stay on camera, turn off camera, but they won't see you in the recording at the end of the day. Jerry, if you don't mind, I'm going to say a quick couple of words about the symposium. I'm going to pass it over. The Rothkoff Law Group hosts this annual symposium every single year. We offer this symposium as an opportunity to bring education and light to some of the areas of the industry that require more thought-provoking discussion. This will be hosted on October 9th. It's an all-day conference. We do offer continuing education credits, but the invitation is open to general public to join so that you can make an educated decision in your senior care needs. We hope that you can visit us at the Live Casino Hotel in Philadelphia. Please go to our website for more information. And thank you again for your time. I'm going to now pass it over to Jerry and Bryan to discuss the One Big Beautiful Bill Act, the impact on older adults and those with disabilities. Thank you, Jerry and Bryan.
Thank you, Laura.
Thank you, Laura. Well, let me welcome everyone. My name is Jerry Rothkoff. I am Managing Attorney of Rothkoff Law Group. With me today is my esteemed colleague and partner, Bryan Adler, and we will tag team today. Hello, Bryan. You want to say hi?
Good morning, everybody, or actually good afternoon now. Thank you all for joining us.
So we will be tag teaming today to talk to you about the One Big Beautiful Bill Act, more specifically, the impact on older adults and those with disabilities. And our focus as an elder care law firm is to be a resource. And what I want to emphasize here is that it takes a team. And what I mean by that is that this is all new to us. You know, the bill is about 3 weeks old. We do not have all the answers. The answers as to the full impact of the bill will be answered over the next few years. But we have some ideas, we have some public policy ideas, and maybe some best practices that we can share with you today. But before that, for those who are not familiar with our firm, Rothkoff Law Group, I just want to spend a minute or so just to address who we are. We are a Philadelphia regional elder care law firm serving both southeastern PA and south and central New Jersey. We have 3 offices in PA. We have currently 5 in New Jersey. We're made up of 7 attorneys, inclusive of Bryan and myself as partners, and 8 geriatric social workers. And our geriatric social workers are of primary importance in addition to the attorneys, because our focus is to get the best care, and then we'll figure out how to pay for it. We also have 2 certified home optimization specialists who assist our clients in maintaining themselves in a safe manner in a home and community basis. We have a health insurance specialist. We have a dementia consultant who helps navigate the issues related to communication with loved ones who are living with some form of dementia, 2 death doulas to deal with end-of-life issues. And ultimately, our goal is to advocate for those with chronic illnesses. And these are the types of cases we handle, but our focus is dealing with chronic illness and helping navigate the issues associated with chronic illness. And ultimately, our focus is to put pieces of a puzzle together. So one of those puzzle pieces that I will share with you is of course, new laws that come out, and such as the One Big Beautiful Bill Act that was signed into law, as most of you know, by President Trump on July 4th of earlier this month. So one of the things what I will tell you is at the outset, we are not neutral here. We are not neutral parties, because we are not neutral parties because I don't think our role is to be neutral. We are biased, and I want you to be aware of that. And Bryan and I will be the first to admit our focus as an elder care law firm is to advocate for older adults and those living with disabilities. So that means inherently we have a bias, and the bias is to advocate for those who need us, and that's older adults and those living with disabilities. So although we will try to be apolitical here, I don't know if at least myself, and I'll let Bryan will speak for himself, can fully achieve that. Our goal is to give you facts and not fiction. So we will give you facts over the next 60 minutes or so. And you yourselves, whether it's caregivers, whether it's long-term care professionals or others, can decide the merits or lack thereof of this new law yourself. But I would like to just kind of go back a little bit and look at the bigger picture. Because in essence, what this bill does, in reality, it cuts almost $1 trillion of Medicaid funds over the life of the bill. So in essence, it's the largest rollback of federal support for healthcare in American history. That's a fact. So, and clearly, it's a fundamental shift in our healthcare priorities in the United States of America. So I want to go harken back, and I want to look at public policy and kind of a bird's eye view. So one of the things I get that I think needs to be addressed in this bill, in reality, it's a big picture, and there's no right or wrong here, is what is the purpose of government? What is government's role in society? So Hubert Humphrey, and that's what in his last speech in 1977, as you recall, Hubert Humphrey was vice president of the United States, and he unsuccessfully ran to be president of the United States. So his quote in his last speech prior to his passing was, "The moral test of government is how it treats those in the dawn of life, the children, those who are in the twilight of life, the elderly, those who are in the shadows of life, the sick, the needy, and the handicapped." 1977, Hubert Humphrey. So if that's Hubert Humphrey's definition of what the purpose of government, I guess the question is, does this bill meet that test? And I'll leave it to you to decide the answer to that question. But one thing I want to go back as a little history lesson here. I've been practicing elder care law for almost 25 years now. So, and although that seems like it went in the blink of an eye, I've seen a lot of changes over the years, over 25 years, advocating for older adults and those living with disabilities. So we're getting called, Bryan and I and our entire team are getting calls from clients saying, well, how does that affect me? Will my mom's Medicaid be cut off? And what changes? Even some of our colleagues, meaning elder law attorneys, are concerned about how it's going to affect themselves. And most importantly, really, we'll look at what have been the significant, what will the significant changes be? So the way you learn and look for, and you can guess the future is to learn from history. So let me go back to 2006 for a couple minutes. And what I want to harken back to is the last major change in Medicaid eligibility and policy. I'm not referring to the Obama years, which of course would be the Medicaid expansion. That's true, but that was mainly the under 65 population. I'm talking about the specifically Medicaid effect on older adults. And in 2006, there were significant changes to the transfer rules regarding eligibility. Mainly the what's called the look back change from 3 years to 5 years in 2006. And there were also changes, probably more impactfully, with how the penalty period for Medicaid is calculated within the 5-year look back. So the question is, why did those changes go into effect? Those changes went into effect because the purpose, at least in Congress, the mantra was, we do not want millionaires on Medicaid. Millionaires shouldn't be on Medicaid. I don't think we can argue against that, but the facts at that time really belied what the mantra was in Congress. Millionaires as a whole were not on Medicaid. There are exceptions, sure, but so we have the look back changes, and we have how the transfer penalty. The question is, did it really result in savings? Did it really change people's perspective on gifting funds to qualify for Medicaid? How's it worked over the past almost 20 years at this point? I think that can be quite debatable, whether those changes have worked. Has it been good for nursing homes? I would argue the answer is no, because in short, in some cases, it creates a period of ineligibility that the nursing homes cannot recoup. And in fact, the changes simply created more bureaucracy in retrospect and created further delays in Medicaid eligibility. If any of you work with older adults and assist in Medicaid applications, you know the significant delays that currently exist in Medicaid eligibility. And I would argue part of that is the bureaucracy, or the additional bureaucracy, that was created almost 20 years ago when this 2006 budget bill called the Deficit Reduction Act went into effect. So, and that brings us back to where we are today with the one big beautiful bill. We're going to talk about some significant Medicaid changes. And keep in mind, most of these provisions would not take effect until January of 27. So we have about a year and a half to gear up for most of the significant changes. And the majority of the changes related to Medicaid affect the under age 65 population, typically the age 50 to 64 population. That's the Obamacare Medicaid expansion population. However, it will certainly affect older adults as well. And it's a 900+ page bill. So there is no way that we will address the vast majority of the changes. Specifically, the tax changes, we will not address. Specifically, tax changes related to high-income owners, that will not be addressed today in the limited time we have. We're going to stick to some basic Medicaid changes and some other changes that affect older adults and those living with disabilities. Similar to, we don't want millionaires should not be on Medicaid. Why was this bill introduced and the provisions passed and signed by President Trump? The current mantra, and this has to do with DOGE as well, which of course for the past 8 or 9 months has certainly been in the news. The goal is to eliminate fraud, waste, and abuse. Eliminate fraud, waste, and abuse, similar to we don't want millionaires on Medicaid, right? Well, the question I think is that you would need to ask ourselves is, does the provisions of this large 900+ page bill do that? That's an open question and will be, I guess, determined over time. But the bill certainly increases the deficit, as scholarly as studies have indicated, and most of the tax provisions will take effect in 2025, including some benefits for our older adults that we'll touch on. But fraud, waste, and abuse. What I will tell you is there fraud, waste, and abuse in Medicare and Medicaid? The answer is yes. And I'm not saying changes should not be made to the program, but the question I think we ask ourselves, does this bill tackle that? And has fraud, waste, and abuse been so substantial that these drastic changes are needed? I think our argument as an elder care law firm is no. in our minds, and specifically in my mind, when there is a large government program, there will be some element of fraud, waste, and abuse. It's the nature of government programs. But do we have to take some of these draconian steps? That's the question, and that's an open question now. So let's get into the crux of it. I'm going to just talk about nursing home staffing, and then I'm going to turn it over to my colleague Bryan Adler. So nursing home staffing requirements. Many of you, I'm sure, have loved ones in a nursing home or work with individuals in nursing homes. And as you probably know, study after study has showed staffing has the most direct impact on quality of care or lack thereof in a nursing home setting. So the Biden administration in April of 2024 issued final regulations through CMS, Centers for Medicare and Medicaid Services, regarding having finally, for the first time in United States history, federal requirements regarding staffing. Keep in mind, there are separate state requirements. Pennsylvania and New Jersey recently updated their nursing home staffing requirements following the pandemic, which is good. But to date, we do not have federal nursing home staffing requirements until April 2024. So what the result of that was that both the American Healthcare Association, as well as Leading Age, which is the for-profit and nursing home lobbying arms, both filed lawsuits in federal court to block them. In short, the One Big Beautiful Bill now explicitly bars the federal government, which is CMS, from enforcing nursing home staffing regulations in nursing homes for 10 years through 2034. So we will, under this bill, there will be no federal minimum staffing regulations for at least 10 years. I would argue that's not a good thing for our nursing home residents. The one item I guess we can say is a good thing is that in addition to the staffing requirements that the Biden administration set out in April of 2024, they also included transparency ownership requirements that do remain because they were already in effect when this law was signed on July 4th. So one of the good things, at least, is meaning when I say transparency as to ownership, the law preserves and expands public access to staffing ownership and information. That nursing homes ownership is a very intricate tentacles, a lot of different corporate ownership, where sometimes the nursing home true operators and owners are hidden in exchange for the corporate identity. So as of April 2024, the nursing homes are required to state their full ownership structure, specifically, and what individual or individuals own a percentage of the nursing home. So that's a good thing. So that stays, but no federal staffing. So with that, I'm going to turn it over to my partner, Bryan Adler, who will take it from here and talk about ABLE accounts.
Thank you, Jerry. And I concur with your assessment of the nursing home staffing requirements. I think it's disappointing. It's an abandonment of a moral covenant I think we have with our weakest citizens, but we'll leave that aside for the moment. So a big change in the law that came about with the One Big Beautiful Act affects these ABLE accounts. An ABLE account, which stands for Achieving a Better Life Experience, was originally established to permit disabled individuals over the age of 26 to create, who were disabled prior to the age of 26, to create an account that they could have access to up to $100,000. It was to avoid the need for costly supplemental or special needs trusts that work and are valuable, but tend not to be as appropriate when you're dealing with fewer dollar amounts, when you're dealing with less money. So an ABLE account has about a $100,000 cap. There's an annual contribution limit currently at $19,000. And prior to the bill, allowed individuals who were disabled prior to the age of 26 to have this money and not disqualify for their Medicaid, supplemental security income, or any other means tested public benefits they may qualify for. The problem with that is a lot of people become disabled after the age of 26. So one of the biggest changes to the ABLE account laws was starting on 1/1 of next year, the age jumps to 46 years old. So if somebody is deemed disabled up to age 46, they can establish one of these accounts without affecting their eligibility for means tested benefits. There are also some additional tax benefits inside of the ABLE accounts. It permits funds in the ABLE account to be rolled over from a 529 educational plan. So, for example, if a grandparent established an educational plan for a grandson or a grandchild, then that grandchild is disabled, those funds can be rolled over to the ABLE account and allow the individual to access them for certain specific uses, again, without jeopardizing their ongoing eligibility for benefits. From our perspective as, again, elder care advocates, disability advocates, this was a positive change. One of the largest complaints about the ABLE account creation was that 26-year-old limitation. So we were actually pleased to see this. Moving forward, we have some key Medicaid changes. Jerry, you want to push this to the next
Oh,
slide,
my
please?
bad.
That's okay. You have control. There we go. So the one big beautiful bill, as we know, it affected Medicaid dramatically, Medicaid being one of the largest line items in the federal budget. And the primary effect is going to be on individuals accessing Medicaid through expansion services. That means Medicaid health insurance, perhaps through Obamacare or the Affordable Care Act. It also affects individuals that will be receiving Medicaid benefits outside of a traditional nursing home. That could be assisted living facilities for those living in New Jersey. It could be individuals receiving home health assistance through the home and community-based waiver services that are in PA and New Jersey. And one of the biggest changes we see there is a biannual redetermination. So typically, when an individual applies for Medicaid, there's this lengthy application process where you file the application, you show that you are clinically eligible, you show that you are financially eligible, and once that's processed, Medicaid benefits are approved. Every 12 months thereafter, you are required to file a redetermination simply to show that you maintained your eligibility financially and clinically. The new rule has flipped that on its head. The redeterminations will now be filed every 6 months. Again, likely only for Medicaid expansion. It remains to be seen on the assisted living, home and community-based side, whether it's going to be biannual or not. Again, we don't expect it for the nursing home. This is a pain, forgive the phrasing, this will be a pain in the ass. A redetermination, while not explicitly challenging, it's not as difficult as an original application process. This is more paperwork. It's an administrative hurdle that will prevent people from theoretically redetermining for their benefits. It creates more paperwork, it creates more challenges, and it creates more gridlock on the administrative level, not just for the recipients, not just the individuals, but on the county side. We have county caseworkers that are reviewing X number of redeterminations every year, and that takes time. Now you're going to ask them to review the exact same amount twice a year. So not only will you have increased paperwork, increased hurdles for the individual, remembering to do this every 6 months, you have overworked caseworkers now. They're going to be increasingly taxed by having to redetermine these every 6 months. Moving forward ahead, Jer.
Oops, sorry about that.
That's okay. All right, so we're on so in addition to the key Medicaid changes on the redetermination side, there are work requirements now. Now, the work requirements only apply to adults age 50 to 64. It's not going to apply to those that are over 65 in a nursing home accessing benefits, but many Medicaid recipients are going to need to verify that they're working at least 80 hours a week per month. And it could be those that have a real health condition or a real health concern. They have to submit this documentation to prove an exemption. Again, it's a key hurdle. Most of those that are over the age, most of the disabled adults under the age of 65 are already working. They're caring for a family member. They're managing the illness of a family member or themselves. The Kaiser Family Foundation published this, that the percentage of those receiving Medicaid under the age of 65 are overwhelmingly already working. What we've created is another administrative hurdle for those that probably already meet the requirements, but now they have to, in addition to annual redeterminations, biannual redeterminations, consistently show that they are attempting to find work, working, or already working. So what the painting that we're trying to elicit here for you, the images we're trying to drive home, are that some of these changes might seem relatively straightforward. Okay, you got to file the same paperwork every 6 months instead of every year. Okay, you've got to submit some paperwork to prove that you're working, attempting to find work, or can't work. But practically, these are increasing hurdles and barriers to accessing benefits you may already be receiving or would otherwise be entitled to under the new bill.
Bryan, let me add a little more context to this.
By all
for
means.
a moment. First off, if you look at study after study, I mean, you just look at facts and look at history. First off, the expansion of Medicaid in 2020 on Obamacare, study after study showed it has saved at least 27,000 lives to date. Secondly, decades of research is well documented shows that work requirements do not move people off of assistance to self-sufficiency. It sounds great. It's a great talking point. I think we can all agree in this Zoom webinar that if any able-bodied person who's able to work should work and not receive Medicaid. I think we all agree on that. But the world doesn't work like that exactly. Let's look, and the best examples of what has occurred over the past 5 to 10 years, and I'm talking 2 states implemented work requirements, and those states are Arkansas and Georgia. If you Google what the results were in Arkansas and Georgia, it has been an utter disaster. It has not worked. And as Bryan rightly indicated, what has it done? It has created an additional bureaucracy, just like in a level that and obstacles people have to overcome. It has documented the cost the state of Georgia $91 million to update technology to address the work requirement issues. And that's similar to the biannual redeterminations. So it also has a trickle-down effect. Now, most of our clients are over age 65, many long-term care Medicaid, but it will certainly indirectly affect them because there's going to be further delays. And Medicaid is a federal and state partnership. Feds have certain rules, but the states, specifically the counties, 60-some counties in PA, 21 counties in New Jersey, have to implement. They each have their own Medicaid offices. And they don't have the staff to handle all this stuff right now, as Bryan indicated. So,
Jerry, you bring up that thought is an interesting point. With Arkansas and Georgia, let's flip the coin on this and talk about what happened in California last year. So California, 1/1/24, they did a study that said eliminating the 5-year look back and eliminating the asset test for nursing home Medicaid will probably cost less, meaning people getting on Medicaid that maybe wouldn't have been on otherwise will cost less than having all these caseworkers reviewing 5 years of bank statements, having to spend down, looking at all of this. So they went the other direction, and I think it's working out relatively well. They recognize that the administrative cost was higher than the actual Medicaid burden.
Good point.
But please continue. I know you were you were definitely on a roll there.
You're good.
All right.
I guess we're talking shortened retro period.
Yeah, so we're moving on to the retroactive period. This is actually a troubling change, particularly from our perspective. Medicaid under current law, when it comes to applying for benefits, you have a 90-day retroactive period to obtain coverage. So what does that practically mean? Imagine we have an individual who entered a nursing home on August 1st, and we need to apply for Medicaid, and that's a huge documentation. It's a huge lift to collect what we need, both on the clinical side, on the financial, and the personal side. We're talking ID cards, marriage certificates, social security cards, some of which people have lost years ago, sometimes birth certificates. We have to get 5 years of bank records and tax returns and deeds. It takes time. to collect all of this. So Medicaid law says if you are eligible August 1st, clinically and financially, you have all of August, all of September, all of October to file an application for benefits to have coverage extended all the way back to August 1st. It provides time. It provides time to collect all this information. And it's particularly important because the majority of families seeking care in a nursing home haven't been planning for it. The majority of families with a loved one entering a nursing home are going in a crisis. Their loved one fell, there was a change in condition, went to the hospital, discharged for rehab, and this loved one can't come home. Having that 90 days, that 3-month retroactive period was critical. It provided a lot of time to, one, collect information, two, not only maintain retroactivity, but it also gives financial security to that family that we're going to have those 3 months covered. By shortening it to 2 months, you have more time to scramble. I'm sorry, you have less time to do it. You have to scramble more quickly. The practical effect is you are more likely to have uncovered time because you simply didn't get the information together to file the application within 60 days. The effect of which, if it takes you 61 days, you have 1 day of private pay. If it takes you 90 days, you have 30 days of private pay that Medicaid simply won't cover. So it's an additional bureaucratic hurdle that's going to make families have to scramble to get the benefits. And from my perspective, and Jerry, add here if you'd like, I see no explicable reason for this other than to frustrate the process. I don't see any benefit to this. Do you?
Well, the only benefit is it will save 30 days of Medicaid taxpayer funds. That's the only benefit in reality.
Presuming it even does.
It's a cost saving mechanism. Well,
yeah,
I
mean,
would
that's
argue
really
then. Yeah. I mean, that's the only I mean, is there any true benefit? Probably not.
No.
At this point in time. So, and it's going to hurt nursing homes because they're going to get less month of coverage. And because of when people enter a nursing home, many individuals, you said, are not aware, don't think they're going to stay there on a long-term basis.
That's right.
So the Medicaid application is not filed. And who's going to get stuck with the bill? It may be nursing homes because they'll have a 1 month additional unreimbursed, and there's no money because the individual is Medicaid eligible, but there's no money to pay that 30 days that would otherwise not be covered.
So you have this. Go ahead, Jerry.
I was just going to go back to the work. I was just going to go back to the work requirements.
Of course.
A couple of you had questions that I saw in the chat. First of all, we'll try to save 10 minutes or so at the back end to answer questions. But a couple of you had questions, I believe, about the work requirements. It's 80 hours per month. So you divide that as to the number of weeks. There are exemptions for anyone who's a caregiver or disabled. Like an individual on SSI, for example, or collecting Social Security disability, they would be considered exempt from the work requirements. I know a couple of you in the chat had those questions, so keep that in mind. But once again, even if you receive the exemption, you would have to affirmatively prove it. It creates additional obstacles for caseworkers who would otherwise be processing applications. And now they have to determine, and each file, they have to determine whether you do or do not meet the work requirements. So it's just an additional obstacle that as was stated over the past 5-10 years, based upon a few states, states who have implemented, it does not work. Go on, Bryan.
Thank you, and very good thoughts. Jumping back to the retroactive period, again, another hit to non-nursing home Medicaid, non-long-term care Medicaid is a 30-day retro period for Medicaid insurance. Now, many of you out there might be thinking, well, what do you need retroactive coverage for with insurance? You apply for insurance and you get it, and then you use it going forward. But there are Medicaid programs for catastrophic illnesses, health disasters that you can't predict. I think back to a family that we're working with. The son had a hemorrhagic stroke and he was working but self-employed, had no health insurance, and he went to the hospital and he had months and months and months of treatment. The hospital, rightfully so, applied for catastrophic Medicaid coverage for him. Now, a longer retroactive period would allow him to get everything together to make sure that his care is paid for, to avoid the potential of a healthcare bankruptcy for the individual or financial problems for the healthcare system. Here, you only have the 30-day retroactive period. So it's going to affect those that need health insurance in a crisis or a healthcare catastrophe, as opposed to just someone who's enrolling who's otherwise arguably healthy but meets the financial criteria. So 30 days, again, it's a way to keep people off benefits when they're encountering high cost healthcare. All right, moving forward.
Yep. Sorry about that.
That's okay. I'm following along here on my own. I've got my own up here too.
All right.
So home and community-based services is something that we work with frequently at Rothkoff Law Group. HCBS, home and community-based services, encompasses a wide array of supports. It could be home care provided in your private residence by a home health agency paid for through Medicaid. It could include life programs or programs for all-inclusive care for the elderly. It could include any number of support services. The information is still emerging on this, but there are most likely going to be some sort of funding reductions that would affect reimbursements not only to nursing homes, but also these programs that are designed to keep older adults in their homes as independent as possible to avoid institutional care. Again, the common theme to all of this is we're squeezing to make it more difficult to access to cut these benefits. But if you look at the research, it's less costly to provide care for someone in their home. It's less costly to provide for someone in a life program or even in assisted living if the state extends Medicaid to assisted living than a nursing home. We frequently sit with families and I say to the families I'm sitting with, the majority of those that we represent wind up in nursing homes out of financial need, not out of a necessary clinical need. Many seniors with cognitive impairment, with physical impairment, or a combination could thrive in a memory care community, in assisted living facility, personal care home, or even in their private residence, whether with a spouse, adult child, or even on their own. But owing to the restrictions put on the Medicaid programs and the overwhelming expense of home care, assisted living, nursing home care, they're driven to a nursing home simply because they need Medicaid benefits and can't afford a less restrictive environment, or these benefits simply aren't available. Jer, any thoughts
And I
there?
might add, as to the cuts, piggybacking what Bryan already mentioned, you have to. I mean, we don't know exactly what the cuts are going to be at the state and local level, but there will be cuts. There has to be. You're talking $900 trillion of Medicaid dollars. So, so states are going to have to decide as a public policy what's priority, because they're going to have less money. Not only is there less Medicaid funds doled out to the states are limited in what now as to what they can tax long-term care providers, specifically nursing homes as well. So they're going to have difficulty raising additional Medicaid funds by taxing the providers. So there will be cuts. We just don't know right now what they will be at the state and local level, to be determined. But most likely there will be some form of cuts.
Jer, I'm going to jump on my soapbox here, as I think we're already on it. There's an irony to this. The overwhelming majority of rural states, poor states, have a higher population on Medicaid and public benefits. So a number of states in the South, the southern states, have more per capita Medicaid public benefits recipients than states in the Northeast, states in the West. Those states are also the poorest in the union, which means they have fewer tax support, they have less wealth on the state government level to backfill this. So in a weird way, again, I'm going to get political here, those states that generally speaking were in support of the administration that passed this are the ones that are going to be hit the hardest. There's going to be less for the state to backfill. There's going to be more cuts to those that arguably were in support of the administration. Now, I think we all know the polls on this are pretty poor. Even those that supported the administration now are against this bill. It's too late now. But the irony is something so thick you could choke on it. Okay. So
what,
go ahead, Jer.
all right, you want to?
No, you can hit, you hit it.
So what does this mean? You're so kind. So what does this mean for you and your loved ones? Well, to a certain extent, it is a pivotal moment for the older adults and those living with disabilities. As when we talked about the redeterminations, we talked about the new work requirements, which will not go into effect again until January 1, 2027. It will make it easier to lose Medicaid coverage and more hoops to go through. So due to procedural mistakes, which there are a lot of hoops to go through as it exists. You know, for example, in Jersey, you need a qualified income trust if your income's above a certain level. You know how many denials there are, probably on a weekly basis in 21 counties in New Jersey, that because the qualified income trust was not funded properly or titled properly. It's just another obstacle that doesn't need to exist. So you need to be organized, proactive planning. You need, you know, kids need to watch over their parents' planning even more. And then, as we talked about, more administrative onerous, potential cuts in benefits. So people are going to need more guidance if you're a long-term care professional to assist to make sure that all the T's are crossed and the I's dotted, so to speak. And you need planned proactively. You got to gear up for those biannual redeterminations that was stated. Ensure your financial house is in order. You have your necessary legal documents in order, and most importantly, talk to someone, whether it's your own CPA, your financial advisor, whether it's a good friend, especially those who may be solo agers who may not have anyone to assist them. It's more important than ever to get that proper advice in place. So, and then I'm going to go I'll kick it back to you for some of the tax provisions, Brian.
I'm thrilled to death.
Forthcoming.
The tax provisions there's some modest adjustments for senior citizens, the new exemption, meaning if you are a relatively low earning senior under 75,000, there's a $6,000 initial tax exemption. Of course, it's higher for married couples. The biggest tax change here, at least from my perspective, is twofold. One is the state and local tax deduction went from 10,000 to 40,000. That means that on your income taxes, you can deduct your state income taxes, your local property taxes from your federal income tax return. It was once 10, now it's 40, so it's a significant jump. It will increase a little bit each year through a cost of living adjustment. Then it reverts back to 10,000 in 2030. As we all know, for many tax cuts, it's hard to take them back. So in 5 years, who knows what's going to happen? But what the biggest tax changes here affect ultra high net worth and ultra high earners. And there's some nibble around the edges too. The no tax on tips, that did not come to fruition, at least not the way it was proposed. There's just a very modest tax deduction on a portion of income received via tips for individuals under an income threshold. I can't recall the exact total. Let me see if I have my notes here. I don't exactly remember what it is, but I think it's like it comes out to about a $1,200 tax deduction. So it's not quite as significant as it was touted, which was if you earn tips, you're not going to pay any taxes on it. And the other big one is for most families, you will never see a federal estate tax or a federal death tax. Prior to this bill, the federal estate tax stood at around $13 million per person, $26 million for a couple. That was set to drop down to about 6 to 7 million per individual, 14, 15 million for a couple at the end of this year. What the One Big Beautiful Bill Act did was it cemented $15 million per person, 30 million for a couple of inflation adjusted every year. From my understanding, it's in perpetuity unless and until a new bill is enacted. So what this practically means is almost no one, certainly no one I know or have ever known, will have to pay federal death tax or federal estate tax, which is significant. You can call that a win if you so choose. Those are the most significant tax changes that we saw there. We can go through as well the timeline. I think it's a little too dense though, Jerry.
Yeah,
and given our time, I'd rather go through the questions.
Can I go back to a couple of the tax issues?
Yeah.
One that really I'll start with the federal estate tax.
Yeah.
You know, not only is it 15 million per person and 30 million per couple, it's going to be adjusted for inflation. In other words, that's going to rise.
That's right.
But here's what doesn't rise. Right now, when you talk about the marital home, if the home, if there's a spouse, I'm not going to get into the difference between Pennsylvania Medicaid law and New Jersey Medicaid law because there is a difference, but that's beyond the scope of today, and we work in both states. But what I will say, let's say if you're in New Jersey and you have a property, you live in Ocean City, New Jersey, and you bought the home, it's your primary residence, or maybe you had a second home, you sold your primary residence, and that you've created that Ocean City, New Jersey property, or you live in Stone Harbor, and you purchased the house for $150,000 30 years ago. Pretty good investment you made, huh? Now it's worth $1.5 million because it happens to be 2 blocks from the beach, and it's a very popular, expensive area where you live. Guess what? The new law, which we didn't even talk about today, creates a cap of home equity at $1 million. States can't change that. And it's not adjusted for inflation any longer as well.
So Jerry,
that
what
house
happens if you have a
above $1
house
million,
worth what happens if it's 1.2 million?
That $200,000 is a countable asset.
Bingo.
You're not eligible for Medicaid. So that is not under the law adjusted for inflation. But someone who has $30 million is adjusted for inflation. I'll leave this question unanswered. Does that make any sense public policy-wise? That's the law.
Now, I will say.
Can I go back to I just want to go back to, I wanted to go back to the 6K exemption for seniors under 75K for a moment.
Yeah.
I've seen on social media, I heard pundits that the One Big Beautiful Bill Act eliminates taxes on your Social Security for seniors. That is not true. Okay? Do not believe that. That is not true. First of all, that $6,000 exemption is only for the next 3 tax years, 4 tax years, 25 through 28. So, and then then that $6,000 is eliminated under this bill. And then it phased out for higher income. Yes, it's a benefit. It gives an individual, an older adult, $6,000 exemption, but it doesn't of adjusted gross income. But it doesn't eliminate tax on Social Security. Just wanted to go over that. Sorry, Brian. Go on.
No, and Jerry, if I'm not mistaken, isn't there something else is increasing, such that a lot of that might even it becomes a wash? Am I mistaken on that?
I'm not sure what you're referring to.
I don't know that I mean either. I vaguely recollect there's a change to, I forget. I could have sworn there was a change to prescription drug coverage. I forget what it is, but a chunk of that 6,000 might be otherwise spent on things that would have otherwise been covered.
Well, that's true. Keep in mind, as I said, there is a great deal that we're not going to discuss. There is changes to Medicare coverage and Medicare, besides Medicaid expansion, certainly for the under 65 population. There are some changes with Medicare taking effect in the future, which we have no time to get to. But this bill is very wide-reaching. It not only touches Medicaid, it touches Medicare as well. So with that, here we're not going to cover this, but and by the way, I know a few of you have asked. Yeah, so we're not going to cover the timeline, but we will be sending all of you the slide deck for your own review, but we wanted just to include the timeline so everyone can understand not only what's included, but when it takes effect. And we included information such as SNAP benefits, talking about Medicare, denial of Medicare coverage for illegal immigrants. We're not going to get into the crux of it today, but that will be part of the timeline that we'll send out. So what takes effect upon enactment, and then you'll see what takes, and then there, as was said, the tips, the SALT 6,000 bonus deduction, that all takes effect in year 2025, and then you'll see what takes effect in 2026. And including the ABLE provisions, and then we keep going It takes effect on October 1, 2026. Then January 1, 2027, which does include the work requirements that we already discussed. And that's the goal. So with that, we're going to save, as I said, it's happy to be 12:50, not too shabby. So I wanted to save about 10 questions for some 10 minutes, I should say, for some Q&A. So we can, Laura, if you're monitoring the comments in the chat, we would be happy to address some of them, or anyone else have any questions that they would like answers on.
Absolutely. So just to clear up some of the questions that have been coming in through the chat, I will be emailing out a PDF version of these slides, as Jerry had said. So yes, you will have these to refer back to. Jerry and Brian, one question that had come in to the session was, so the reduction in taxes on Social Security will expire when this administration term is over. How are all of these cuts and deductions being offset, if at all?
Huh, that is a very good question. These deductions, the argument is they're being offset. The tax deductions are being offset by the cuts to Medicaid and other programs, but they're not. The black and white numbers are that these cuts will overwhelmingly increase the federal deficit to the tune of, Jerry, $1 trillion over 10 years.
I don't know specific numbers, but I know it's significant.
There is no offset, and I'll go out on a limb here and say that anybody that says this will pay for itself is either delusional or dishonest.
I think, the theory is, and again, it depends on your view of the role of government and the role and economics. But isn't this more like a trickle-down economic theory, in the sense that if we put more money back in the pockets of everyday Americans, they're going to spend the money, and that will stimulate the economy even greater, and basically create more opportunities for individuals?
You made their argument
And
pretty
again,
nicely.
you can,
I don't know that it works.
Yeah. So, but
Yeah, that's right.
Another question that we received, any changes to Medicaid transfer penalties within the bill?
No.
No, and that's the important part about it, and we get questions on, and I'll just elaborate. The only changes were to the, which is important nonetheless, which is significant, is to the retroactive period of ineligibility, especially if someone in a nursing home setting. But there are no specific changes at this time with the 5-year look-back rule, but the transfer penalties within the 5-year look-back rule. It should have no effect on the nursing home Medicaid population, other than the shorter period of retroactivity. But I still think it will affect the nursing home population in this way, which we have discussed, but I believe it's important. Because you're going to have a shorter period of eligibility as well, and the problems that exist, and I think you're going to have further delays in the processing of applications, I think the nursing homes themselves will be more circumspect with who they admit and the financial requirements required for admission.
So what Jerry's getting at there is, nursing homes are not permitted under federal law to discriminate against a resident based on source of payment. So if mom moves into a facility and no matter how she gets there, if that facility accepts her, that nursing home accepts that individual, and he or she is laying in a bed and says, I need to access Medicaid, that facility by law has to accept Medicaid as a payer source, presuming the facility, which almost all do, accepts Medicaid as a payer source. Now, that is often misunderstood, it's miscommunicated, but that's the reality. With these changes, I'm sorry, let me take a step back. When you knock on the door and say, my loved one needs a nursing home, and they review the clinic, they're welcome to say, let me see the clinicals, let me see the financials before they will admit someone. They're permitted to discriminate at the door based on source of payment if you don't have the money. So what Jerry's saying is going to be more difficult when we start knocking on doors. You're going to say, show us money. show us that you have 3 months, 6 months, a year, 2 years worth of private payment. So it will increase the number of residents that are coming out of hospital stays into nursing homes as their primary entry to a facility if they don't have the resources, the key money to get into a facility they're choosing. It's going to make it much more difficult to get in.
Thank you. Another question came in. Will changes to Medicaid impact those who are purchasing medical coverage via the marketplace, i.e. Penny?
Want to address that, Brian?
Yeah, it will. That when you're on a Medicaid expansion policy, now if you're on a traditional Affordable Care Act policy where you're just paying for it through the marketplace, I don't believe you're going to have any significant effects. But if you're accessing Medicaid health insurance program because you meet the financial criteria, you qualify for a Medicaid health insurance, you're going to have those work requirements attached to it. It's going to be more, you're going to have to redetermine, if you have to file your notice of redetermination every 6 months, and you'll have to prove that you're either working or unable to work or providing caregiving. So you're gonna have more hurdles to access those programs.
We only have a couple of moments left, so I'm going to keep pushing forward with a few more questions. What impact is this going to have on nursing homes?
You know, that's a great question. We've already seen staffing shortages in nursing homes that are leading to increased response times, increased turnover, units or beds being shut down, for lack of a better word, or being inaccessible because it can't be staffed. And that's largely because of, there's a variety of reasons: immigration issues, funding issues, ample opportunities elsewhere for a much less challenging, physically demanding, mentally demanding job. There's a lot of reasons for it. What you're going to see here, though, as Jerry alluded to earlier, that 60-day retro period, everything being squeezed, it's going to affect the nursing home's bottom line, which means they got to cut somewhere. And most likely it's going to be cutting staffing, cutting services, cutting supports. So you might see rural nursing homes close. That's already been addressed. A lot of nursing homes that are in more rural areas, figure Pennsylvania's counties outside of central PA, western or southeastern PA, nursing homes there could be at risk. Nursing homes in poorer states are going to be at risk because the funding might not be there. It's going to be cut. So I think it's going to be pretty dramatic. You're going to see it on the provision level and on the corporate level.
It's to be determined. I mean, we can have a 6-hour program on the health and stability of the nursing home industry in this country. It's not going to be a pretty picture. I mean, we
I don't
talked to
think you
our
can
colleagues.
describe it
We
as
just came
the
back.
health.
Yeah, we just came back from a conference in Harrisburg last week. We talked to our colleagues from Western PA, the Pittsburgh area. There are dozens upon dozens of bankruptcies in nursing homes. We're not seeing it the same extent in the eastern part of Pennsylvania as the western part. I don't know specifically why, but it's not a pretty picture right now. And what I will say, though, is this, and if we look at this, and again, I'm not here to say what the ultimate impact will be of this bill on nursing homes, because I don't know. But let me look at it from this perspective. Let me analyze it from this perspective. Over the past 2 decades plus, over the past 20 to 30 years, the goal, even the federal government's goal and state government's goal, typically has been to reduce the number of nursing home residents in this country.
Not agree more.
And thankfully, more and more home and community-based services are available over the past 2 to 3 decades to provide services for those in need outside of a nursing home setting. And that's a beautiful thing. And that is sorely needed, a least restrictive setting. So nursing home care is quite expensive, the most expensive care. Let's provide alternative means to individuals. And that's why we see what's called the Medicaid waiver programs in both Pennsylvania and New Jersey. We still have a large gap in Pennsylvania, granted, as to Medicaid coverage for assisted living. At least it's available in New Jersey, at least on a limited basis. But we have waiver programs in both states. We have home care Medicaid. We have that covers adult daycare, and all of these different waivers that covers the under 65 individuals living with a disability, the ComCare waiver, the TBI waiver in Pennsylvania. We have these different waiver programs that are huge, that allow individuals to live in a home and community-based setting out of an institutionalized nursing home, which is fantastic. So what are we saying to ourselves with this bill? We're saying to ourselves, does this bill put a halt to that, the movement for a least restrictive setting and more opportunities in a home and community-based setting? Because there will be cuts in a home and community-based setting. There's not going to be cuts in a nursing home setting under Medicaid. So do we halt 2 or 3 decades of progress for those who want to stay in a home and community-based setting and deserve to stay in a home and community-based setting? I don't have an answer to that, but I'm a little concerned about that, to say the least.
I agree.
So with that, on that hopefully apparently not so happy note, but let me just end on an optimistic note, because we try. I mean, our goal is to advocate for those older adults and those living with disabilities of all ages. And yes, this bill is very troubling, but there are still opportunities out there for advocacy. And I think the opportunities for advocacy at this point is not going to be so much on the federal level, it's going to be on the state level. So that's where we need to spend our time, our money, and our efforts, is to continue to advocate, in our case, both in Pennsylvania and New Jersey, at the state level and even the local level, to make sure that there is no draconian cuts and ensure that a very deserving population continues to receive needed benefits to live in a home and community-based setting. So with that, I thank you for everyone for participating today. I hope that you found it valuable. Thank you for Laura and Bryan for your valuable contributions. Thank you all for attending. And back to where we started. Our focus for all of you as an elder and disability law firm is to simply be a resource. So if you have any questions about not only this bill, but your loved one, yourselves, feel free to reach out to us. You have our info. As Laura said, she'll send out the slide deck to you. And don't be a stranger. Please use us as a resource, and we'll provide updates, and if necessary, have a further webinar as the full impact of this bill becomes known, because our goal is to advocate for the individuals that we are privileged to advocate for. So thank you all for attending. We very much appreciate your valuable time today.
Thank you, everybody. Best of luck to all of you. We look forward to working with you in the future.
Thank you.
Thank you.
You're quite welcome.